Assalamu alaikum. The clinical day. First scenario, Mr. Kumar is 30 years old, came with complaint of fever, sweating, and weight loss. Please sit with him, examine, and address his concerns. If you're ready, you can start now, Dr. Hajun.
Okay. Hi,
Hi.
my name is Dr. Osman. I am the doctor here in the clinic today. May I confirm you that Mr. Kumar, 30 years old?
Yes, doctor.
Nice to meet you, Mr. Kumar.
Thank you.
Okay, today we are here to discuss about your condition. Is that okay with you?
Okay.
And if you don't mind, I will examine you and I ask you a question and answer your concern. Is that okay?
Okay.
Okay. Come to my knowledge, Mr. Kumar, from your GP that you are suffering from high body temperature and weight loss. Can you tell me more about that?
Yes,
During the
doctor.
last, I'm
Yes,
so
doctor.
sorry.
Actually, I have fever since 3 weeks. Also, I have more sweating and loss of weight. I want to know, you doctor, what happened with me?
Okay. Did you have ever like this condition before?
No, for the first time.
Okay. Can I ask you, did you measure your temperature during this 3 week ever?
Yeah, I measure many times from 38.9 to 39.
Okay. Is it constant all the day or come and go, Mr. Kumar?
Come and go. When I take paracetamol tablet, fever go and come back after 2 hours.
Okay. It's also associated with sweating. Am I right?
Yes, doctor.
Okay. Is it night time? Came at night time or all the day?
All the day,
Okay.
but more at night.
Okay. And also, you lose your weight. Is this
Yes,
period?
doctor, I lose more weight. I lose 3 kilogram over 3 weeks.
Only in this period.
Yes, doctor.
Okay. Is it intentional, Mr. Kumar?
No.
To Okay. Tell me about your appetite of this duration or this period.
When fever start, I have poor appetite.
Okay. Do you have any lump or bumps in your body?
No,
Any nasty growth?
no.
Did you travel during this period or before it
Yeah, I travel since 5 months to
to
Africa.
where? To Africa?
Mm.
Okay. Did you take your malaria prophylaxis
Yes,
during
doctor.
during travel before it and complete it after you regained back or came back to your UK?
Yeah, I complete course of malaria prophylaxis.
Okay. I'm so sorry. I need to ask you some private question if you don't mind, and usually ask my patient about it. Is that
Okay,
okay?
doctor.
Okay.
Okay.
Do you have any unprotected sex before
No,
this? Like, did you have any tattoo or body
no,
piercing?
no.
Did you share needle, Mr. Kamar?
Actually, doctor, sometimes I share needle. I am using heroin.
Okay. Can I ask you, Mr. Kamar, do you have any heart problem before?
No,
Okay. Do you have any raising of your heartbeat?
sometimes. When
Okay.
fever increase, I experience increase of my heart. I feel my heart racing
Okay. Do you have any chest pain?
a little.
Okay. Any legs swelling?
No,
Okay. Do you underwent any tooth procedure, Mr. Kumar, during this period or before it?
no,
Okay. Do you have any headache or neck stiffness?
no. Sometimes I have headache with fever, but no neck. اللي احنا بنقول عليها ايه؟ No neck stiffness.
Okay. Do you have any cough
No,
or coughing blood?
no,
Okay. Do you have any loose motion or tummy pain?
no,
Do you have any pain with your water work, Mr. Kumar?
no,
Any discharge from private
no,
area?
no,
Do you have any change in color of urine or water work? I'm sorry.
no, no.
Do you have any skin rash, Mr. Komar?
No,
Any joint pain?
no,
Do you have any past history I should aware about it?
no, doctor.
Did you underwent any surgery before?
No,
Do you have any, are you allergy from any drug or any
no,
medication?
no.
Okay, can you show me your medication list, please?
Actually, I don't take any medicine except sometimes I take paracetamol tablet for this fever.
Okay. Uh, are you smoking, Mr. Kumar?
No,
Okay. Are you taking alcohol?
no.
Okay. Can you examine you, Mr. Kumar?
Okay.
First, I need to see the vital sign, pulse,
Pulse 100,
regular or not,
regular.
blood pressure,
Blood pressure 120/80,
temperature.
37.8.
Okay. I need to check finger, the patient hand and finger, any splinter hemorrhage,
Yes,
any clubbing,
no,
any gangway lesion, ossular node.
no,
I need to see the face, any pale or any pallor or jaundice in the sclera.
no,
I need to see if there is any mouth ulcer.
no.
I need to see the dental hygiene of the patient.
Good dental hygiene.
Okay, any lymph node in the neck.
No,
In the chest, I need to see the heart. First of all, I need to put the patient in 45 degree. I need to see the JVB, is it raised or not?
no.
I need to see if there is any out sound.
There is pansystolic murmur, parasternal.
Okay. I need to check the base of the chest for any crepitations for heart failure,
No, no,
any lower limb edema.
no.
Also, I need to check the abdomen, mainly in the upper right quadrant, if tender or any liver
I feel little pain.
tenderness.
Tender hepatomegaly.
Okay. I think I finished examination. Mm, Can I ask you, Mr. Kumar, do you have any concern?
What I have, doctor?
Actually, Mr. Kumar, from the history I took from you and examine you, it's most probably kind of infection of your lining layer of heart. Also involves the area of the gate between the chamber of your heart, this gate area called valve. And the infection actually affect this area and lead to symptoms as you suffer.
Oh my
Are you
God.
with me?
Sorry, doctor?
Actually, yes, Mr. Kumar, is serious if untreated. I'm so sorry to tell you that, but if untreated, it will be serious. But be sure we are here to help you and to provide the best and the proper management for you. And first of all, we need to admit you, Mr. Kumar. Okay? Is that okay with you?
Okay, doctor.
Okay, we'll
Okay.
admit you and we'll run investigation, blood investigation for you, and also we do tracing for your heart and also kind of video for the heart to see, as I told you, this valve area as I prescribed to see if there is any abnormality on it. And also we'll start the plan of your management in the best of interest your condition. Is that okay?
Can I go home, doctor, and I take medication with me at home?
I appreciate your concern, Mr. Kumar, but as I told you, this condition is serious if not treated. So the admission for you is crucial for your case, and the best for your interest of your condition, the best interest for your condition, and will your condition need to be admitted first of all to run investigation to confirm our diagnosis first of all, and to start the proper management as it need. Is that okay?
Okay, doctor. Okay.
Do you have any concern, Mr. Kumar?
No, thank you, doctor.
Thank you, Mr. Kumar.
Okay, seems you finished, but Do you think you missed something you want to ask about in the social and the occupational? Still, you have still 5 minutes or 4 minutes. No, it's 5 minutes. Revise your history. What you missed to be professional and perfect. What do you think, Dr. Hajwa, you missed in the history? Hello?
Yes, I use you. I'm thinking, overthinking.
Okay.
Sweating, palpitation, everything, everything on me.
No. Okay. If you didn't miss system, I think you
Yeah.
miss the CNS and the headache analysis, but
No
there is some
headache. Yeah.
occupational. Yeah, occupational. What is important, the occupational, to ask about?
Occupational wise,
Yeah.
regard this patient.
Mhm.
Um,
Do you think the job is important in this scenario or any scenario?
for any scenario or this
The
scenario.
job, the job. Any scenario and maybe this scenario, but the job is something you have to ask about, right? And the impact on over his job, right?
Mm.
Yes, I saw
Okay.
this only in communication.
Did you ask? No. Here also you have to ask about the job. Did you ask?
No, they didn't ask about the job.
Okay. One more social history you missed. Then we can start the examination.
Social history apart from smoking and alcohol. Now you add
Smoking,
occupation.
alcohol, travel,
Travel, I asked it in history.
medical, surgical. Yeah, what miss?
Mm.
Very important.
Very
If
important.
yeah, if this patient is having valvular heart disease in his adulthood or since he was a child, so what's important or history you have to ask in this scenario and in this condition?
Valvular disease. You have
Valvular, yeah,
prosthetic valve or something?
or congenital.
Fever.
No, yes, I asked him about do you have any heart problem before? He said no.
No, family. I mean, did you ask about the family?
No, family. No,
Okay,
no, no.
so these are the two system you didn't ask, or two things you didn't ask: the family and the occupation. Otherwise, you did perfect. Let's start the examiner question. Dr. Suzanne, please, can you start?
What? Okay. What's your diagnosis?
Differential or diagnose?
Diagnosis and differential diagnosis, both.
Okay. Actually, according to finding, this 30 years old male with fever and sweating, loss of weight, with valvular regurg, and also he's drug abuser with positive sign of infective endocarditis like splinter hemorrhage and also the valvular regurg.
Mm.
My top differential, it will be infective endocarditis.
Okay. What's your differential diagnosis?
Okay, also other infection like HIV
Mm.
and also tuberculosis, but I think against that, no cough or no chest symptoms.
Mm.
Also, it could be vasculitis anywhere, but against that, no joint pain or no arthritis.
Mm.
And also, my differential diagnosis will be cancer.
Okay. What investigation will you do for this patient?
Okay, a part of general investigation, first of all, I will do general investigation like CBC. I need to see if there is anemia or not. I will do liver function test, renal function test also to exclude any renal impairment as maybe embolic septic emboli to renal artery. And also I need to check urine dipstick. And also I need to see the inflammatory marker ESR and CRP.
Mm.
And okay, also I need to do investigation for reaching my diagnosis. Like I need to do first of all blood culture for this patient.
Can
And
you explain more about this blood culture?
I'm not sure, but I think we need to take 2 to 3 sample. I think
Mm.
from
Yes.
different side.
Mm.
Yes, I think
Okay.
so. And
Okay.
also we need to do echo to see the regear valve. Also we need to see if there is vegetation or not. And also we need to do ECG and just X-ray. ECG, I think, for if there is any BR, prolonged BR interval. For
What's the importance of prolonged BR intervals?
I think aortic root abscess, aortic valve root abscess. I think so.
What's the treatment of this patient? How you manage?
Okay, first of all, I will admit the patient and I will do for him non-pharmacological and pharmacological kind of treatment. And non-pharmacological, like counseling the patient and education the patient, occupational health worker, and multidisciplinary team. I think cardiology, infectious doctor. And regard the pharmacological, antibiotic.
Okay.
You finished, Dr. Susan? Questions?
Yeah.
Okay, tell me what's the possible organism in the blood culture, Dr. Haju?
Like this patient now is acute presentation. First of all, it will be Staph aureus.
Is it because of the acute presentation or because of something else?
Yes, acute presentation with native valve.
Okay, what valve affected in this patient mostly?
Tricuspid valve.
Tricuspid, perfect. Why you said tricuspid, not mitral?
Because background of IV abuser.
Perfect. So the possible organism due to the drug abuser, not the acute presentation. Is it?
Streptococcus epidermis, no.
No. Streptococcal. This is the possible if the patient has metallic valve. But if the patient is drug abused, so the first organism will be the Staphylococcus aureus. Clear now?
Yes, Staph aureus, as I said, but I start
Yeah.
to
But
be
you
a
correlate
doubt.
to the acute presentation. No, it's related to the drug abuse and the sharing needles.
Not
Okay.
epidermis, doctor? Sharing needle, not epidermis?
Epidermis or Staphylococcus aureus? Both of them.
Staph aureus.
Both of them
But
both of them are flora to the skin, right? Over the skin.
yeah, but I think with IV abuser, I think epidermis is more than Staph.
Again, both of them are skin flora.
Equally?
Staph aureus is more common in IV drug abuser.
Yeah.
Okay. As acute presentation.
Not as acute.
No, يعني acute
The
presentation.
prevalence. Yeah. No. It's the prevalence related to the drug abuse or sharing needles. If not, you can change the prevalence according to the nature of the valve or the colonoscopy, for example, or something invasive procedure else like dental procedure or colonoscopy, as I mentioned. So don't make it as acute presentation reason. No, it's related to the drug itself, the sharing needles. Okay.
Okay.
I think the time is up for the discussion. We can start commenting. Dr. Suzanne, please.
تمام. هو أنا بس جارجون واحد اللي قريته في she mentioned only one jargon regarding neck stiffness. Must be unable to bend neck. كمان
Okay,
also
but I guess stiffness is okay. You can say it. It's non-jargon. It's
not
non-jargon. Yes, stiff because stiff is something we know about. Okay, so it's yeah. What else?
otherwise she take organized history ما شاء الله and she asked about everything. Nothing. I have no
Okay.
comment.
Okay.
Doctor, can he ask about treatment of infective endocarditis? He can ask about what antibiotic we use and like this, or only we say antibiotic.
Yes, of course.
No.
Yes, there is questions. Any question can be according to the case scenario, started from the admission, the investigation, ended by the treatment or the management plan. So be ready for all these questions.
Oh, for me, I guess I need to say antibiotic, or I need to get more detail about that.
The best answer is antibiotics according to the guidelines. Okay, this is the
وزود
best answer. If
كلمتين.
he asks specifically, now you
مم.
can say according to the valve nature, is it metallic valve or native valve? And according to the possible organism, is it Staphylococcus, Streptococcus?
Mm,
So accordingly, you
Dr.
will answer.
Bassam,
Yes, Dr. Salma.
I want to ask you some question after this good presentation of Dr. Hajwa. Dr. Hajwa did it like station 5 before, targeted and to the point only, examination-wise and history-wise. But now they cancel the history station and they make it long clinical consultation. So I believe that we should fulfill all the all the history steps, regardless of we reach the diagnosis or not. But if we did like Dr. Hajwa, mashallah, she did well and she reached the diagnosis very well in a targeted station 5 way. Could we still pass the station like this?
Sorry, you asked question now?
Yes.
Yeah, it's not like this. She, as you said, she should ask all questions, all system review, and I think she missed a lot of system. She didn't ask about any GI system here, right?
Yeah, because she did it like station 5 wise.
Yeah, she make it
Targeted.
very
Yeah.
condensed, and she missed some system. That's why I supposed to comment about this. In the system review, she missed the analysis of the headache. She didn't also ask about other CNS manifestation. In weakness, this patient is drug abuse. He might have stroke if he has vegetation. He might present with a stroke, right? So he might have weakness or any neurological deficit. It's important to ask about this. She she should ask about any vision problem. This patient might have immunological deposition in the retina, which is rough spots. So the patient might have vision problem, right? She should ask about any vision affection. She missed totally the CNS, including the
Yes.
eye and vision. And this
Yes.
is, yeah, this is defective in her approach and taking history. Although she reached the diagnosis, but she
Yeah.
should ask other all system review.
And also she asked if we have to ask about job in long clinical consultation. I will tell you something, Dr. Hajwa.
Yes,
There is a case of brucellosis. If you see this case, there is no positive data except the back pain and the back pain and fever. Then all the answer of the long clinical consultation was in the job of the patient. When you ask the patient, what is your job? He will tell you, I am a sheep keeper or something. He's working in a farm. So you will not reach the diagnosis if you did not ask about job. And also in long clinical consultation, we asking about job to offer help, because maybe one of the concerns
exactly.
that you will get mark on it that the patient is not going to his work because of his illness.
Yes,
He's suffering too much. This is not only in the communication, because there is also evaluation for the communication in the long clinical consultation.
exactly. You're right, Dr. Salma. The job only, not only the job, you have to ask the job and the impact of this presentation or of these symptoms on his or her job. Why? You might offer sick leave to this patient if he said to you, Doctor, I'm unable to do anything. I cannot do my daily activity. So at least if his job will be affected, you have to offer him sick leave.
Yes.
And if he has something related to the job, like he's driving and
Mm-hmm.
he's depending on his driving, you can involve the occupational and the DIVLA for his driving issue. So it's not the matter of getting the diagnosis and try to finish the case. No, you have to complete your history taking, social, occupational, and the examination steps. Even the
Yes, please.
examination,
Yeah,
yeah, go
please
on.
put your YouTube link because I want to memorize from your steps of history, please. I tried to search it, I didn't find. For me and for Dr. Hajwa and for everyone. Okay?
Okay,
Dr.
sure.
Basim?
For the yes,
Yeah.
sure. I will
Thank
add
you.
it. System review, Dr. Hajwa, you have to ask about every system in the body. Started by CNS, as Dr. Rasalma said, the endocrine, the cardiovascular, the respiratory or chest, abdomen, genitourinary, and musculoskeletal, any joint pain, skin rash. All these questions or all these systems should be asked to analyze and to pick up any positive finding. In this patient, you met the genitourinary, right? Or you ask about any change of the water work, but you can specify question for the water work. What question you have to ask here, Dr. Hajwa, related to the water work or the urine?
No, actually, I asked about pain during water work, discharge,
Okay, perfect.
any change of water
Discharge.
color.
What else? Yeah. So what you expect to have in this patient scenario, if he has infective endocarditis, what the possible
Mm.
complication related to the renal system? He
Or,
might
or
have hematuria, right? Hematuria.
yes, color of water cannot
So
be
yes,
just under that. If
yes,
I
I know,
ask
but I
about
mean,
change of water
I
color,
mean, yeah, yes, you're right. But you can ask specifically any blood in your because you get the case and you have a time, right? And you can
yeah,
add it to the yeah bedside test, urine
Dr. Basim,
dipstick
color is not
to
covering
check
blood. I heard from one mentor that sometimes they specifically told the surrogate if the candidate did not ask any
any
blood
blood.
in your
Yes,
urine, do not answer. You just say normal. My water work is nothing in my no problem in the color,
yeah,
because
exactly.
and vice versa. If you ask, do you have any blood in your water work, and he did not ask dark urine, also he might misguide you and not answer you, because darkening of the urine can be in other causes like paroxysmal nocturnal,
Yes,
acute intermittent porphyria. There is no blood, but
exactly.
there is change in the color.
Darkening. Exactly.
Yeah. So the questions of the urine should be any change in your water work, color, amount, frequency. After that, على طول, any blood in your water work specifically.
Exactly. Yeah, I agree for this. And always ask question makes sense, Dr. Hajwa. So it's not a matter of I will finish this system only. I want to know what is there. Maybe there is hematuria because I have infective endocarditis. You catch the case, right? So what are the presentation mostly the patient will present with? In this scenario, he might present with hematuria, or he might present with acute kidney injury, decrease urine output. So please ask the specific question, not only any change of the water work and that's it. So we are learning, by the way, I am not blaming you, but we are learning how to do full and perfect history. We want to take the full mark. Any question related to any finding, you will get a mark on it. Okay? Let's go back to the social. As I said, you have to ask about family, travel, and past medical history, which is the medical or surgical allergy. You missed the allergy here. You are going to prescribe antibiotics for this patient, right? So how about the antibiotics allergy? He might have allergy from penicillin, for example. And
yes,
penicillin,
I asked him about any allergy for any
you
medication.
ask? Okay,
Yes,
perfect. Good.
yes, I asked
By the
him.
way, I'm not asking to blame. I'm just
No,
asking to
you
be
are not
okay.
blaming me,
Okay.
doctor. No, but it's
Okay.
my first time to present this.
Yes,
يعني,
by the way, you did perfect. But I noticed
no,
when
Yes.
now
I'm
I'm learning because I saw
yes,
something
perfect.
about if I
Okay.
need to check. I saw something according to my revision, which is very limited
Yes.
revision actually. I saw something about when I need to exclude symptoms. So I thought that like now we need to exclude if I need to cover GIT like in this patient, regardless if I reach the diagnosis or not. I thought something like that because I put my differential diagnosis about
Okay.
this patient, Mr. Komar. I thought there is any gastroenteritis or something in his bowel.
Okay.
So I thought loose motion and tummy pain, it will cover. So I thought that if
Okay.
I ask him about any regurg, if any heartburn, if any big upper abdomen, I thought it's no benefit for that. I think
No, no.
I
Okay.
think about that.
I
I
will
think if
ask.
I
Okay, I will ask you know now the question related to the GI, and it might be positive in this scenario. What is the possible presentation or symptom he might have related to the GI, and it might be positive in this scenario? Dr. Hajwa, the question for you.
think mesenteric infection, maybe pain and bloody
Um,
urea, bloody
okay,
bloody.
okay, as a complication, you mean? Okay, maybe there is thrombosis and showering. Okay, maybe. What else?
In GI, in patient background of
Yes,
infective endocarditis,
exactly. Yes.
a part of septic emboli.
It's a septic emboli, but in some other organ.
Uh, s-
What do you
mm,
think? What the organ might be? Sorry. What organ might be enlarged in this patient?
okay. Splenomegaly, someone written that.
Yes,
Yeah.
exactly. So
Not
splenomegaly
covered
as
by tummy pain
tummy pain or
or
tummy
tummy discomfort.
discomfort. Yes.
Hmm.
That's why don't ask single question, or you can ask specific question you might think it is possible to be in this scenario. For example, if you ask any tummy pain, he said no, but you suspect the splenomegaly might be associated with the infective endocarditis. So I can say, do you have any tummy fullness or
Hmm.
discomfort? Okay. If I skipped or I forget to ask, at the end during the examination, I should offer examining the spleen, right?
Yeah. Actually, I concentrate only in the right upper quadrant for liver, like if there is any tender liver or something. Uh,
Yes.
yeah.
Now you know what are the association of infective endocarditis. You mentioned part of them while examining the hand, which are splinter hemorrhage, ocular nodules, and Genway lesion, right? This is in the hand. And the
Yeah.
eyes, rough spot, right?
No, I didn't
And
mention
how
the
you,
extent.
no, yeah, but how to offer examining rough spot?
Slit lamp.
No, by the, because it's in the retina. So you will offer fundoscopy, which you didn't
Mm,
offer. One more thing you didn't offer and examine the injection mark, right? This patient is
elbow
using
hand.
drugs.
Elbow. Yes.
Yeah, yeah, either in the cubital area or even you can offer the inguinal because they are using accessible areas, which are the inguinal for the vein or the cubital, right? Believe me,
Yes.
these things will give you the full mark. You will satisfy the examiner. If you ask these things, everyone will know the infective endocarditis. But what are the golden things you will ask about to get the full mark? These things, these small things. Okay,
Dr.
the
Basim,
offer of
why vision
endoscopy,
problem? Why vision problem in infective endocarditis? Explain to me just.
retinopathy,
Retinopathy,
retinopathy, or
Septic
this
emboli
rose spot. Yes,
septic emboli. Okay. Broad
it's not
spot can
septic.
cause blurry vision or
Rose
something?
spot is immunological. Rose spot is immunological.
Mm-hmm. But it cannot cause vision problem, right?
Why not? It's retina,
Uh, can cause
right?
cloudiness or blurry vision?
Haziness, maybe haziness, yes, but not loss
Oh,
of vision.
okay,
Any
okay,
retinopathy might present with this.
okay,
Okay,
okay. Thank
this
you.
is
in
for
CNS. I thought.
yeah. CNS also
Yeah.
might present with stroke.
Yeah,
Patient
it's
might
very important
present with
area.
stroke.
Actually, I thought it's just I need to
Yeah,
exclude if there is meningitis or encephalitis, so I just stuck on headache and
yeah,
neck stiffness. This I thought I just only exclude it, and by which I will cover the same system. So yes, I
perfect.
need to ask about if there is any weakness, any facial
Yes,
change,
yes,
or mouth deviation, any visual problem. Yes, very important.
perfect. Plus the headache analysis. She said to you, "I have headache." Analyze
Sometimes
it.
yes. Yeah, yeah.
At least roll it is something not alarming. So yes, there is headache. It's related to the fever. We know, but be
Yeah.
sure this is not something alarming.
increase with sneezing or leaning
Yes,
for
exactly. So it's not headache related to increase intercare pressure. Perfect.
Yes, yes.
Okay, now you know how to play the game. It's a game. How to show the examiner that you are screening well, you are examining perfect, and you are giving advices. You didn't even tell him, please stop drug abuse or the cocaine, right?
Yeah.
You can ask him one question: when was the last time you share a needle? And give him advice in the same time, please. This is very risky and dangerous habit and behavior. Please, if you need some help, we can refer you to the assigned team to help you to stop this thing, because it might harm you. Okay.
Okay.
Any question or any comment from others? I'm finished my comment. Anyone has comment, please, he can add.
السلام عليكم.
وعليكم السلام. Yes.
الكفرنج للهيستوري very important طبعا في التو لونج كيسز. ليه؟ لانه it will help us to pass the communication skills في ال 11 السكور بتاع الباسنج في الكوميونيكيشن is 11 right. So
Yes,
try
exactly.
to
Yes.
gain يعني more score from long cases. Two long cases you have 4 score right.
Yes.
Because you cannot
You-
guarantee to pass the communication station itself.
Yes, you're right. It's 4 skills, right? It's 4 marks, sorry, in four stations, 2 long and 2 communication,
Yes.
and you have to pass 11 mark.
It is easy, I think, to pick this 8 score from long stations.
Yes, of course, you have to get it from the long station, and you don't have guarantee that you might miss some marks from other station. So please take full and organized systematic history.
Yes.
Thank you, Dr. Rashid, for the advice. Any other advice or any comment,
Yes.
suggestion?
It's a question,
Yes,
Dr.
Dr.
Basim.
Basim.
Salam alaikum.
Alaikum assalam wa rahmatullahi wa barakatuh. Okay.
I joined late
Yeah.
and I want to know the case, if you don't mind.
Yes,
What
Dr.
is the
Sar,
case?
right?
Yes, effective endocarditis.
Yeah, infective endocarditis because of sharing needles and drug abuse.
The presenting complaint
Was constitutional symptoms, fever and loss of weight and sweating.
Thank you.
Most welcome. Dr. Muhi?
أنا بس I wanted to say that infective endocarditis diagnosis is not easy like Dr. Suzanne said in the scenario. Because it will practice,
Okay.
it is like
What do you mean?
it is like pyrexia of unknown origin. It is like malignancy. It is like connective tissue disease. Less likely to say this is infective endocarditis and there is systolic murmur on the tricuspid valve, because in real practice we do echo every day. We found severe tricuspid regurg without detecting renal area. So it is not easy for us to diagnose this in real practice by this. So maybe this case come in the exam by only constitutional symptoms and some clue while you are examining the patient. There is no either peripheral stigmata of infective endocarditis or local in the heart that there is systolic murmur or heart failure, or even in the left system, left heart or in the right heart. Okay, this I
Yeah.
want to add.
Okay, thank you, Dr. Mahi. You're right.
Sorry,
That's why
Dr.
we have to ask about other system. Yes, go ahead.
Yes, sorry, Dr. Bas. Regarding the frame for the history, if started the case by constitutional symptoms, I will follow the constitutional symptoms and I will ask about them. Then I will go for the past medical history. Then I will go for the other system. What is your opinion regarding the frame?
Yes, this is my best favorable approach, to start by the relevant system. Of course, the analysis of the complaint, onset, course, duration, then the relevant system. In this scenario, for example, constitutional symptoms, right? So I will ask about other constitutional symptoms: loss of weight, loss of appetite, lumps or bumps, and night sweat, night body temperature. This is for the constitutional symptoms. Then I will ask about past medical history, any past medical history, heart disease, diabetes, immunocompromised patient. Just rule out the immunocompromised state, for example. And system review, followed by the past medical history, system review. And I will go ahead with the social after that, family, travel, HIV. Finally, I will end by social occupational history. Do you smoke? Do you drink alcohol? Do you drive? What's your job and the impact on your job? This is what I shared in the website now. There is link for the video how to take history in systemic way. This is my best approach. Anyone has another approach he can follow, but this is what I prefer to do. As you exactly what you mentioned, Dr. Ahmed. Okay. Any question else? I will read the comment. Dr. Hajwa, please prepare or write the scenario for Dr. Susan.
Read it. I need to read it for you now.
Can you share it?
Okay, you wrote in the chat box.
I will read the comment quickly. No empathy. Yeah, I believe also you have to be more empathetic with the patient while taking history. I'm so sorry for your suffering. It must be difficult for you. I know it's quite hard to pass through these symptoms like this. Okay, some phrases and some words to share the feeling with him. What is the full analysis of fever itself? Yeah, I guess also she asked only about the temperature, how much it was. I think she asked about the timing. It was on overnight, and she asked any previous attack, which is also good to ask because this is first time. If on and off or recurrent, so I might think about cancer or something hidden. What is the scenario? Yes, thank Dr. Maha. We already shared the scenario. I don't know if you saw the scenario. Sorry, I didn't see this message. Sharing needles will affect communication scores. Yes, of course. By the way, the question, the impact of this over your job is very important. They might deduct marks because of this question. If you miss this question, they might deduct a mark. Please, whenever you ask the job, ask the impact on your job. Okay? Because he might say, yes, I am a driver. Then you skipped. It's not related to the scenario. Yes, but it might be related to by indirect way. So you have to ask him how the impact of this over your job or over your driving. He will say, no, doctor, I'm okay if I'm having no fever, I can drive. But it will not be okay if he said, yes, doctor, I cannot drive if I am febrile, right? So you have to address this point. Ask it to get the full mark for communication skill.
Actually, Doctor,
Yes. Yeah,
shall I?
yeah, go ahead.
I will not mention the name of the doctor as I took the course with him. When he was given us the long consultation cases, he just did as a frame. Just yes, we need to go deep regard to picking the positive, to analyze the positive, to picking the information that you need to take it to reach the diagnosis. Okay, but regard if you need yes, now I have regard this headache. Our CNS, as you told me, because one of our one of our complication of the case, we have a stroke, so we need to moralize. By the way, he didn't do that for us, and just he mentioned just a head point when you need to go to the systematic review. Head point. And regards the communication or the social history, he just uh, give also, as I told you, hint regard. You need just to ask about the impact, like driving, say social, like just smoking, alcohol and driving, if there is any advice you need to give for the patient. But regard you need to ask about the impact and like that. No, he didn't mention this point for us because it's a communication manner. It's not
Okay.
a long consultation. As
No,
I
it's
took the
okay.
as I took the course with him actually.
I will answer your this concept. If you check the marking system for the long clinical consultation, there is a mark on this question particularly. I will try to find it and I will share it. The impact on the job and the other history taking. It's one of the skills in the communication. One of the point you have to ask in the communication skill. And it's nothing to ask this question because he might need some support. He might need some any support. I mean, at home, he might tell you, "I cannot cope with my daily activity. I cannot even help myself at home. I'm living alone."
Yes,
Okay.
I learn now. Actually from you
Okay.
and my
Okay.
colleagues.
So
Yes,
it's
it's very
important.
important
Believe.
because
Yes. Yes. I thought you are
yes,
saying
I get
it's not
this.
important. Yeah.
No,
No,
no, no,
it's
no, at
important.
all.
Okay.
Because I just I'm depending on the course as I took. I'm not blaming the doctor, by the way, but I am depending
Okay. It's
just because I just put this as a fixed information to my plan when I go to
yeah.
take a history for long consultation. I will not deal the point as in the communication and vice versa, like that.
Perfect.
Yeah.
So now you learn the point and others also. The good thing you mentioned that because maybe others also thought thinking the same thought that it's not necessary to ask this question, but it's very important to ask it. Okay.
Yeah.
Thank you, Dr. Ajwa. Let's start the other second scenario. Mr. Ahmed, 30 years old, complain of hematuria, blood pressure 160/90, temperature 38, heart rate is 90. If you're ready, you can start.
Okay, doctor.
Dr. Hajwa, ready?
Yeah, actually, really, yes.
Okay, let's read these two comments before starting. Counsel the patient about needle sharing program, yes, and how important to screen the patient against other blood-borne infection. Okay, agree for the HIV, for example, yes, it's important to roll it out. Any of his dental procedure, Dr. Mawadda. She asked the dental, I think, procedure or surgery.
Yes, yes, yes.
Yeah, by name. It was perfect question. I agree with Dr. Mahi, especially no metallic valve surgery. Actually, while thinking on brucellosis and HIV rather than endocarditis. Okay, thank you, Dr. Rashid. So we can start now the second scenario. Here you go.
Hello.
Hello.
Hello. I am Dr.
Yes.
Ali, senior house officer in the medical clinic today. May I confirm I am speaking to Mr. Ahmed, 30 years old?
Yes, doctor.
Hello.
Yes, doctor. Yes.
We are here
Mhm.
to discuss about your medical. We are here to discuss about your medical health condition. Is it okay for you?
Yes, doctor.
Okay. It came to my knowledge, Mr. Ahmed, you are complaining of bloody urine. Can you explain me more about this?
Yes, doctor. Actually, 3 days back, I go as usual to bathroom. So I thought as my urine start to come red, frank red, I thought it will disappear, and I took just a little pint of water, and I start to get rest. But over 3 days, it continue as same. Nothing changed. So I came to seek him for help.
Is this the first time, Mr. Ahmed, to experience this bloody urine?
Yes, doctor. It's my first time.
Okay. And this bloody urine every time you pee or come and go?
Yeah, over these 3 days, yes. It's mostly just come as red.
I am so sorry for your suffering, Mr. Ahmed. I will help you. Um, any trauma, Mr. Ahmed?
No, I didn't get any trauma.
Okay. Um, any specific timing in the day you experience this blood urine increase, like morning?
No, I didn't appreciate any specific time. It's just whenever I go to bathroom, so I thought like this.
Can you tell me, Mr. Ahmed, what's the color of your urine?
Yes, it's red. Red. Yes, I'm sure it's red.
Did you notice any blood clot?
No, no. Oh, yeah, no, I'm not sure. Just red. It come all the passage red.
Okay, Mr. Ahmed. Can you tell me when this blood urine it come in the beginning of urine stream or throughout your urine stream or at the end?
Yes,
Any
as you
specific
said.
time
As you said, throughout.
throughout urine stream?
Yeah, I remember because I was shocked when I see this red every time. So I didn't appreciate the exact, but I think yes, it's all the stream.
Sorry for your suffering, Mr. Ahmed. Can you tell me, Mr. Ahmed, any bleeding from any other part of your body from nose? Any bleeding from nose?
No, no,
Any easy bruising?
no,
Any coughing of blood?
no,
Any throw up of blood?
no,
Any blood from your back passage?
no,
Okay. Do you experience any pain when you pee?
no, no,
Did you notice any stones?
no,
Any change of amount of your urine?
no,
Any frozen urine?
no, no.
Okay. Do you have any recent sore throat?
Yes, doctor. Recent sore throat. Yes, I felt my throat as dry and I start to feel as having pain while I'm swallowing. And I guess I think suffer from like common cold and
Since when?
suffering. Uh, uh, Before the attacks of this red urine with 2 3 days like that.
It means since 5 days.
Yes, I think so.
Okay. Did you seek medical advice for this sore throat?
No, I just start to take paracetamol for weakness and body pain and this mild fever, and also start to drink hot drinks only.
Okay. Okay. And now there is sore throat. You are experience pain now?
No, no,
Okay. Any cough?
no,
Any noisy breathing?
no.
Okay. Any fever?
Yes, during throat, yes, I felt I have just like my body temperature start to raise. Just when I take paracetamol, I calm down.
And now you have fever?
No, I don't think.
Okay. Any weight loss?
No, during this period, no,
Okay. Any headache?
no,
Um, any vision problem?
no,
Any weakness in your limb?
no,
Any pins or needle sensation in your body?
no,
Okay. Any awareness of your heartbeat?
no, no,
Okay. Do you awake at night searching for air?
no,
Any leg swelling?
no, doctor.
Any tummy pain?
Tummy pain?
Hmm.
No,
Any change in your bowel habit?
no,
Any rash in your body?
no,
Any rash on exposure to sun?
no,
Any joint pain?
no, joint pain. Just during these 3 days of throat, I just feel my body weakness. Just no, no joint pain specifically.
Sorry for your suffering, Mr. Ahmed. Anyone comment you look pale?
No, no pain, no. No one comment.
Any, okay. Any dizziness on standing?
No,
Any shortness of breath with any effort?
no, no shortness of breath.
Okay. Any medical history of any disease, medical disease?
Before, no, I have nothing. No.
Any history of surgery or any procedure?
No.
Okay. Any family history of similar condition?
Family history? No, like me? No, but yes, I remember my father he has or had like kidney cancer, and now he passed away from this kidney cancer.
Sorry for your loss, Mr. Ahmed. Um, can you show me your medication list?
Medication list? No, just only have vitamin C tablet for throat. It was and also paracetamol, nothing more.
Okay. Any recent travel?
No,
Any history of swimming in fresh water?
no.
Okay. What's your job, Mr. Ahmed?
Job recently now I'm working in bookshops, bookshop. But before 3 months back, I was working in rubber factory, doctor. But I said the work is heavy, and I collect some money. I did my own job. Now I having this book shop only.
Okay. Does this complaint affect your work?
Yes, because I became worried. So I start to return back to home and close my shop just because I'm thinking I have problem. Maybe like my father.
Sorry for your suffering. I refer you to occupational health service. They will help you regarding this issue. Is it okay for you?
Okay, doctor.
Do you smoke, Mr. Ahmed?
Yes, I smoke.
How much cigarette over how long?
About 6 cigarettes per day in the last 10 years.
Okay, you know, smoking is dangerous for your health. I advise you to stop smoking. Is it okay for you?
Yes, doctor. I
If
hope
you
so.
don't mind,
I will try. I will try.
if you don't, okay. If you don't mind, I can refer you to smoking cessation clinic. Is it okay for you?
Yeah, I appreciate that.
Okay. Do you drink alcohol?
No, doctor.
Okay. Can I examine you?
Yeah.
I will examine hand for pallor. First, I will check pulse.
Normal pulse, 80 beat per minute.
Okay. Blood pressure.
Normal, 110 over 70.
Temperature.
38.
Okay. I'll check for anemia. Also, I'll search for tremors. I'll
Yes,
check
anemia, mild pallor in the conjunctiva.
any tremors.
No tremor.
Okay. I will check abdomen. I'll inspection first for any distension. I'll palpate for any palatable kidney. I'll search for any organomegaly. I'll no. Okay.
Yeah, one negative.
Okay. I will listen for any wheezing in chest.
No wheeze.
Okay. I'll examine eye for any pallor, cyanosis, jaundice.
Yes, mild pallor, but no cyanosis, no jaundice.
Okay. I will check nose for any nasal crust.
Normal nose.
I'll check mouth for pallor, for any mouth sores. I'll check throat for any sore throat or any infection.
No, nothing. Just mild congestion in the throat, but nothing in the mouth.
Can I know what's your concern?
Do you have? Did I have cancer, doctor? Like my father?
I appreciate your concern, Mr. Ahmed. it's possibility, but it's less likely to have cancer. We must do some investigation first to confirm our diagnosis and exclude other. You most probably have a condition related to your throat infection before. This throat infection can affect your kidney, and you experience hematuria because of kidney affection.
How can be, doctor? Yeah, from throat
Sometimes
to
it is unknown, maybe due to defect in your defense system, which is supposed to fight bugs and virus. It's misdirected by proteins come from this throat infection and attack your kidney. Are you following me, Mr. Ahmed?
yes, doctor.
Okay. Do you have any other concern?
2 minutes left.
Yes, doctor. I need not to get like this attack again, because actually it's shockable attack to see your urine is red. Do you help me
I am
regarding this?
I am so sorry for your suffering, Mr. Ahmed. I will refer you to group of doctors to trace your condition and to evaluate your kidney, and we will do a plan of management for you, and we'll do the needful for you in order you will not experience this condition. But unfortunately, some patients with this condition have recurrent attack, and I am so sorry to tell you, some patient may, fortunately, there is some patient can experience mild symptoms and can go without medication, and the other patient may develop more serious disease and can affect their kidney. And I am so sorry to tell you that some patient may experience severe kidney disease and may need kidney transplant. I am so sorry for this bad news, Mr. Ahmed.
Okay, but as you said, some people will not get anything, and you will
Yes,
help me.
it's a possibility.
I hope to help me, doctor. I have no concern. Thank you.
Okay, thank you. Do you have any other concern?
No, doctor. Thank you.
Thank you.
Okay, let's go to the examiner questions. Now, Dr. Ajwa, you can start.
Yeah. Okay. Summarize your finding, doctor.
Mr. Ahmed, 30 years, complained of hematuria, and this hematuria is preceded by sore throat 3 days before infection. It's no history of renal disease before, and from his it's most probably due to IgA nephropathy.
Okay. This is your diagnosis, doctor.
أقول examination بقى. أنا
Did
قلت
you
لك
summarize the patient? Now you summarize the patient. You summarize the finding. Can you tell me your differential, doctor?
it may be post-streptococcal glomerulonephritis, but against it, it take more time. It happened 1 to 2 weeks after throat infection. Also for stones, but against patient didn't notice any lower urinary symptoms, or he didn't notice any stones. Maybe pyelonephritis, but patient didn't experience any fever or pain. Endocarditis, but heart examination was normal. تمام.
Okay. What's your workup for this patient?
أو الانفستيجيشن الأول. I will, apart from basic investigation, CBC, to search for anemia, blood gas to check for any metabolic acidosis due to kidney affection. I will do urine analysis for CAS, blood protein. I will do also ESR, CRB for any infection or connective tissue disease, renal function test. I'll search also for calcium and urate in urine. CBK for rhabdomyolysis, ANA, rheumatoid factor, anti-Smith antibody. I'll do ultrasound, abdominal ultrasound, KUB. Also, I will screen for pulmonary renal syndrome, C-ANCA, B-ANCA.
Okay.
Okay.
CT abdomen ultrasound.
Yeah, CT without contrast. Yeah. أنا قلت ultrasound.
Okay. What's your plan for treatment?
Non-pharmacological treatment. I will health education and I will counsel about sodium restriction for this patient, and also for pharmacological treatment. I will give him ACE inhibitors for high blood pressure, and also will manage proteinuria. And also if proteinuria increase heavy more than 1 gram, I will start steroid for him. And in progressive condition not responding to treatment, patient may need renal transplant.
How you will follow this patient?
I will admit patient and do basic investigation for him, and I will involve nephrology doctor.
Yeah, the follow-up will be like your plan for follow-up. This
For
patient
up,
free.
he's for admission.
Yes,
Patient
right
for
now.
admission. Right now for admission.
Yes, then you will stabilize his blood pressure by ACE inhibitor,
Yeah.
and you will check the urine for him if there is any proteinuria.
If heavy proteinuria, I will start steroids.
Yeah. Okay.
Mm. Mm.
I finished the question.
Okay, I will ask because we have 30 seconds more. Will you
Okay.
plan for dialysis? Any chance this patient might be for dialysis?
Right now, no. Maybe in the future.
Yeah,
And
because you
according
mentioned
to
transplant, right?
yeah,
But there is also possibility for renal replacement therapy.
yeah.
Okay.
We fit
What
criteria of dialysis.
yeah. What is the antibodies you will check in this patient?
Antibodies, IgA level.
Yeah, perfect. Okay. Any other antibodies or any specific lab?
Anti-GBM antibody to exclude good partial syndrome.
Okay. Will you do complement?
C3 and C4.
Okay. Time is up. Let's have the comment from Dr. Ajwa, please. You can start.
Actually, I'm not arrange myself in this case now, yeah, for any question, but I think she covered well everything.
Okay.
The plan of
Okay.
Victoria,
Thank
would
you,
you please
Dr. Ajwa.
explain the fever? Would you please explain the fever?
No, I think it's written just by mistake because now I have no fever. Yes, the patient have no
Yes.
fever, but it's written mistakenly. Yes.
Okay. So, Dr. Suzanne, I will ask you, what are your differential? And give me differential makes sense. Okay, because you mentioned everything. I need specific related differential.
First, stones.
Why you
At this
mentioned
age,
stone?
30 years old, I will exclude cancer because patient don't have any weight loss.
Yeah, so this is the most sensible differential because of family history.
عشان
But
family
stones,
history أوي.
yeah, but stones I think it's not at all as a differential. Why? Because no history of stone and no flank pain, no hematuria or sorry, no dysuria. So a stone is little bit unlikely. But cancer, yes, there is possibility. Why?
because family history also
Yeah.
is job كان بيشتغل في factory تقريبا.
Exactly. So this is the most wrong differential. What other differential? Now you have IgA nephropathy and this cancer, medullary carcinoma, sorry, renal cell carcinoma, and what else?
بص streptococcal.
Yes, as glomerulonephritis cause, you have to mention post-septicoccal. Although it's preceded by 2 weeks, or in this scenario it was 5 days, but still it's one of the differential in young age. Some doctors wrote polycystic kidney disease. I agree because also polycystic kidney disease might convert to cancer, right? That's why you have to examine the kidney. I don't know if you examined the kidney. Did you examine the kidney?
Only by palpation for palatable kidney.
You did it. You did
Yeah.
ballotment?
Yeah.
Okay.
But
I
it's
heard
good
only.
differential, Dr. Bas.
Sorry?
It is good differential and there is high blood pressure. It's
Yes,
hematuria.
exactly. Yes, you're right. Okay, I'll ask Dr. Susan again one more question. Is it nephritic or nephrotic? IgA nephrotic.
Nephritic come with high blood pressure.
Perfect. Yes, it's nephritic syndrome. Yeah, I think you did great, Dr. Susan. You cover the system review well. Although you ask some question in the complaint and the relevant system, which is the urinary system, then you ask other question like I think respiratory or crust, then back to the renal, or you ask about blood in other from other orifice, right, or other parts from the body. But anyway, in general, really you cover most of the question, the system review, the social, you cover all the history and the occupational, also the job you ask about it. The impact, I don't know if you ask about the impact on his
I
job.
asked it.
Yeah,
Yeah.
okay, perfect. The examination also was to the target, apart from lymph nodes. I guess you didn't ask lymph node in the neck because
Yeah, I didn't ask.
yeah, you offer examining the mouth, but offer examine lymph nodes.
Because of
But
fever?
yes, because of fever and infection.
Yeah.
And for the previous scenario as well, we have to offer lymph node because it might be HIV, as it was mentioned as differential. We have to examine for lymphadenopathy for the previous scenario, but in this scenario only cervical.
Yeah.
And Dr.
Okay.
Basim, I have one comment.
Yes,
Yes,
sure, Dr. Dani.
I think she did not read her scenario very well because she
Dr.
asked about
Maha,
the blood
sorry.
pressure. Yes, she
Yeah.
asked about the blood pressure and she asked about the temperature, and she given her a wrong answer. When she asked about the blood pressure, she told her that it is normal 110/70. Okay,
Uh-huh.
while it is given in the scenario like 160 or 80. Okay, it is high blood pressure already. Okay,
Yes.
so I just read the scenario very well.
Yes, you're right. At least offer the vitals, as you said, Dr. Maha. If he said to you, it's normal, okay, I will trust the examiner. But I have to ask every single vital. For example, if I notice that he has high blood pressure, I will ask him how the blood pressure.
Yeah,
And I
it is
should
given
offer.
in the scenario, Dr. Basim, sorry for interrupting you, but it is
Yes,
given in the
I know.
scenario that yes, yeah. But after that, when she asked her, she told her that it is
Normal.
normal.
Okay.
Yes.
I don't know if it was
And
missed
she
by
made me
Dr.
confused also. Yeah, she made
No,
me
no, no.
confused.
You will have to trust the scenario, but maybe the blood pressure now is okay. Maybe the patient took medication, antihypertensive. You got it. So trust the surrogate or the examiner because you will ask this question to the examiner. I want to know the vitals. He will tell you either as outside, or he will tell you skip, or he will tell you it's normal. I
But
know
what
it
I saw,
was.
these vital signs now, or what do you think? This is
No,
the
no.
referral vital
Sometimes,
sign?
yeah, sometimes from the GP himself. He
Okay.
referred to you this patient with high blood pressure, and now you ask for the blood pressure. He will tell you the blood pressure is normal, or it's okay, or high, or skip it. But you're right. I have to give attention to this. That
Yes.
I notice the blood pressure is high, even
Yes,
in
and
the
we have
history
to mention
taking.
it even, yeah. We have to mention it
Exactly.
in the finding because it is a finding. if missed
To
that,
Exactly.
ask more about the blood pressure itself.
Yes, this is from
يعني
the past medical
for
history.
how long is this blood pressure?
Exactly. Yes.
If
Yes,
if
you're
this
right.
is recent, it is going with our condition. Kidney injury like that from IgA nephropathy. If it is something old, another meaning.
Perfect. Yes. So I will ask it in the past medical history as well. I noticed in your paper that your blood pressure is high. Is it just recently or it was before, like that? By this way, you pay attention to the examiner that you
Yeah,
notice.
if the patient is taking any medication for this blood pressure, if it started or not yet. Yes.
Of course, you have to ask medication history. I think Dr. Susan didn't ask about medication
No,
list.
she asked.
She
She
asked
asked
or
about, yes, she asked, but she told her that she's taking only vitamin C for the sore throat and paracetamol for fever.
yeah, perfect. So, mashallah, every question Dr. Susan asked, I'm remembering something she missed, but it's not missed. Perfect,
I
really,
remember
Dr. Susan.
I forget to ask about deafness or history of deafness to exclude Albert.
Perfect, yeah. Yes, you have to, especially with family history. You're right.
Mm.
And it came one time in one diet. I think in Kenya, someone mentioned this scenario before. Patient with present with hematuria and only deafness. Imagine I did this case with Dr. Azhar, I remember, and it was Alport syndrome because of deafness associated with hematuria. Apart from this, patient doesn't have anything else. I missed the case, of course, because I didn't ask about hearing. But you are lucky. This is not the case of Alport. We have to specify a question for the deafness or hearing problem if you have hematuria or renal affection.
Yes, and
Just
family
to
history
pick
as well.
exact family history. Yeah, he might tell you my father have kidney disease along with hearing issue.
Usually it is not the father. Usually it is the uncles and the mother. Okay, maybe the mother because it is
X-linked.
X-linked. Yes. Okay, so
Mhm.
maybe the mother have deafness because it is not well expressed in females. Okay, so there is it will express, but in few symptoms like deafness, but it will not come with renal failure unless it is autosomal dominant. There is one variant as autosomal dominant. Okay, but we have
Yes.
to ask about the mother family if they have anything, grandfather and the uncles and yes, and the mother itself, if they have history of deafness or renal failure, hematuria, all these things.
Yes. Perfect.
Dr.
Sorry,
Basim,
Dr.
question.
Basim.
Sorry.
Yes.
I want to ask about clarifying macroscopic and microscopic hematuria. I get confused about what diseases causes macroscopic and what causes microscopic hematuria.
So how you know that this is micro or macro?
When the patient tell you that I have a bloody urine, it's a
Yeah,
macroscopic
this is
hematuria.
macro exactly, and the micro when
In
it's
the renal analysis, urine
exactly.
analysis.
So yeah, it's not obvious.
Mhm.
Yeah,
Yeah,
but
I'm
as a
asking about the
pathology,
disease.
the pathology
Mhm.
itself, no, I'm not in a position to say which condition can cause a macro.
I think renal stones, cancers can cause gross hematuria. It's macroscopic hematuria, okay? And renal stones can cause as well, okay? In case like polycystic kidney, it can cause, okay, macroscopic
Macro,
hematuria. Yes, but for pyelonephritis and these things, it will come like microscopic hematuria only.
glomerulonephritis also
Yes,
maybe micro.
glomerulonephritis, micro hematuria.
This is
Micro,
IgA
yes,
nephropathy,
micro.
especially
What
IgA
about
nephropathy.
TB, Dr. Basim? What about TB?
TB,
Yes. Is it one
you
of the
mean
differential in this case?
papillary necrosis?
Schistosoma is the one. Schistosoma is the one that comes with macroscopic hematuria, terminal hematuria. But
Mhm.
TB, I'm not very sure, actually.
TB can cause, I think, papillary necrosis, right? What you mean by TB? TB,
Yes, TB, one of
pyelonephritis?
the papillary necrosis. Yes, it can cause
Papillary
papillary
necrosis, yes,
necrosis.
yeah.
Yes, yeah,
I think also papillary necrosis might be as microscopic.
yes,
Urethral, something extrarenal might be as macro
yes. Anything in the bladder or the urethra,
macroscopic. I think so,
local,
yes.
any
Yeah,
local, it will come with macroscopic hematuria.
Exactly,
Yes,
yes.
but anything in the kidney, unless those things like cancer or stone or polycystic kidney because of the bleeding cyst, okay? So it will come with macroscopic hematuria. Otherwise,
Perfect.
all glomerulonephritis will come with microscopic hematuria.
Thank you, Dr. Maha. So let's make it as also glomerulonephritis, so that the kidney, the membrane, will lose the protection from passing the blood through it, right? So it would be microscopic. Agree for that, Dr. Maha? So glomerulonephritis will be microscopic.
Yes, glomerulonephritis microscopic.
Dr. Basim,
Uh-huh.
البابيلر usually I think macroscopic because there is shedding زي مثلا في السيكل cell anemia and other condition there is shedding of papilla to the pelvis
So
and
because of necrosis, yes, okay.
usually macroscopic البابيلر what I know.
Really,
بقرأ الجرانولا.
I'm not really, it needs some nephrologist to mention about this. I'm not aware about the details. But anyway, Dr. Maha summarized it in good way. Thank you, Dr. Maha. Anything related to extrarenal, like injury to the ureter or urethra or urinary bladder, it would be with macroscopic. But something related to microscopic change of the membranes, it would be microscopic hematuria.
That is why macroscopic hematuria is a work
Exactly.
of urologist. It is a urologist issue. It is not a nephrologist issue.
Yeah, because you cannot see it. Okay.
Yes,
Yeah,
yes.
perfect. Okay, thank you, Dr. Ma. Any other questions someone want to ask?
Yes,
Please,
sorry,
Dr.
Dr. Bassem. Regarding the history here, we can make the past medical history also before the other systems.
But medical
Because
history,
here
of course,
she-
yes.
Yeah, because here she did the systems before the past medical.
Okay. For me, I prefer to ask past medical history after the constitutional symptoms. Why? Because if this patient, for example, is sickler patient, and he told me, yes, I am diagnosed with blood disease called sickler. At least now I know some possible differential I might correlate to the pathology, which is sickle cell anemia. For example, I will say this is papillary necrosis, right? But
Yes.
if I kept taking history as system review and I postpone the past medical history, I will be more stressed. I didn't reach the diagnosis. What the possible cause now? Until I will ask the past medical history, maybe I will be panic. I cannot ask this past medical history, so I will lose the case. But I prefer to ask the past medical history after the constitutional symptoms and the complaint. This is my best approach. So it's preferred to be before the system review. I might have a clue or something I can link the case to the past medical history. For example, if I have diabetes, I can suspect nephropathy, for example, right? Or if I have another condition like kidney stone, I have before renal stone with, if I ask, for example, did you have any past medical history? Yes, doctor, I had a history of stone and I did lithotripsy, for example. So I can suspect renal stone. But if I didn't ask this question, maybe it will be difficult to pick up this finding or this diagnosis. Clear now?
Yes, clear.
Okay.
Thank you.
Most welcome. Who else? Someone was asking?
I think also we should offer camera test this cystoscopy for this patient also. Even it is going with renal disease and there is hematuria. We can, because we don't know this is differential diagnosis. We are not sure 100% of the diagnosis. We can tell also, we refer to the renal
Occupational,
doctor
you mean?
or to do this camera test also, I think. What's your opinion?
Okay. You suspect cystic or something related to the bladder, right?
Yes.
Because of the occupational or the job.
Yes.
So you mean bladder cancer?
Yes.
Okay, you're right. Because of the occupational exposure, you're right. You might offer cystoscopy. But please, Dr. Susan, you made your investigation very wide. You didn't give specific investigation for the case, right? You said I will do antibody, anti-double strain, and anti-Smith Why you suspect SLE in this patient?
To exclude vasculitis as a cause of hematuria.
But you have to have some history finding to suspect vasculitis. So you
Yeah.
not do everything for everything.
Uh,
At least mention the specific investigation related to our case. You suspect something which might be 90 or 80% correct. IgA nephropathy. So I will do the specific test for IgA nephropathy. You will mention urine analysis, urine dipstick. This is specific. And IgA antibody level. If he
Okay.
asks you what else you want to screen, what other differential, even you didn't put it in the differential, right?
Yeah.
So don't waste the investigation and lab workup. Don't say everything. Mention the specific. And whenever you start to mention, start by general investigation, specific investigation, and bedside test, non-invasive ultrasound, and invasive tests, cystoscopy, as Dr. mentioned. For the general, what's important to do here, Dr. Susan?
General investigations.
Yeah, very important test you have to do. You have bleeding,
Anemia, exclude anemia.
so
And
the
the
hemoglobin for
INR,
anemia.
reading
Exactly. Yeah,
profile.
this is the one. So this is
Mm.
very important to mention. General investigation, CBC to exclude anemia. You have to mention that, and coagulation profile to rule out any coagulopathy. Okay.
And ask for anemia itself in the history, guys.
She mentioned, I think, pallor. She asked about anyone told you are paler, right? Or anemia in the examination.
Dizziness
Like
and
Dizziness
from
and
dizziness.
standing.
Yeah.
Like
from
that.
Yes,
sitting,
exactly.
and I think she need to check the blood pressure sitting and stand.
Yes, this is very important. Whenever you have
Yes.
blood pressure, offer, especially if you suspect anemia, offer the blood pressure sitting and standing to rule out positional hypotension. Any patient or any scenario you suspect dizziness or anemia, please offer blood pressure sitting and standing. It will not harm you if you said, "Can I check the blood pressure?" He will tell you as outside. Okay, can I know if there is drop by after standing from sitting? Just like that. He will tell you skip. By the way, he will not tell you, okay, measure the blood pressure. But please do it when it makes sense. Don't ask it in every patient. But most of the patient having dizziness and anemia or syncope, you have to measure blood pressure sitting and standing. Clear?
Clear.
Okay, any question else? Any comment? The concern, Dr.
Sorry, regarding the treatment here.
Yes, perfect.
He will guide me that it is post-streptococcal glomerulonephritis, the examiner, or IgA nephropathy, and he will ask me regarding these two topics, or it will be wide treatment according to the wide differential diagnosis.
He will start by as a general, because our rule always start by non-pharmacological and pharmacological. Non-pharmacological multidisciplinary team approach, urology, nephrologist, specialized nurse. If you suspect inherited conditions, so you'll say genetic counselor or genetic team, specialized there, social worker. And if you need the physiotherapy, if you need, you can offer. But in this scenario, I don't think he needs. Then start the counseling about the disease and the complication association. Then you jump to the specific or the pharmacological therapy. In this scenario, you can offer blood transfusion if the patient is severely anemic. For the specific management, as Dr. Susan said, possibility to use steroid, possibility to have renal replacement therapy, or it might be as supportive for the symptoms like blood pressure, ACE inhibitor, and that's it. No specific management related, and not all patients will be responsive to steroid, by the way. And the recurrence rate is high. And the possibility of renal replacement therapy and kidney failure is still there. So it's not specific management, but you have to mention all these things together.
Okay,
For
appreciate it
specific
really. Thank you very much.
management, Dr. Basim,
Yes,
it depends upon the proteinuria, okay, the presence of proteinuria or not, okay, and the blood pressure as well. If there is high blood pressure, we will start the ACE inhibitor immediately, okay. If blood pressure is normal, most of the patient will come with normal blood pressure, okay. It is not like post-streptococcal, yes. So if the blood pressure is normal, we will depend upon the proteinuria. If there is no proteinuria, it will be watchful waiting, okay, just
Yes.
follow-ups only, okay. If it is minimal proteinuria, patient will be started on ACE inhibitor even if the blood pressure is normal, okay. And yes, okay, for proteinuria control, okay. So and if it is nephrotic range proteinuria, patient will be started on steroids.
Okay.
I think
So it
smoking is a very important.
to stop smoking, you mean?
Yes, to stop smoking and to ask early in the.
Any
Yeah,
patient
she asked, I
with,
think.
yes, any patient with risk factor for heart disease, okay, like hypertension, we have to, yes, ask about smoking very early and advise to stop.
Okay, I remember also there is prognostic factors for IgA nephropathy, right? Like the male has a good prognosis or
Age,
IgA nephropathy.
age of frank hematuria,
Yes. And the male having a good prognosis?
male and young age, and frank hematuria, I think, not sure.
Okay, we can search about them. But I don't think they will ask this question. But anyway, just for the refreshment, anyone has
معلش
this
Dr.
information?
Basim, I have it in Bas Medicine.
Yeah, please.
Markers of poor prognosis, male gender, okay, proteinuria, especially more than 2 grams per day, hypertension, smoking, hyperlipidemia, and ACE genotype double D. I don't know what
Perfect.
is that exactly. Yes.
Remove the
And
last one. No need for it.
yeah, and the markers of good prognosis is the frank hematuria, isolated frank hematuria.
Isolated hematuria and female.
Yeah. They did not mention, but I think yes. And
Because the male is bad prognosis, right?
yes, yes. And 25% of patients will develop end-stage renal disease.
Perfect. So it's not high
And
number,
yes,
high
and there is
percentage.
number for the proteinuria as well. If isolated hematuria or minimal proteinuria less than 500 to 1 gram per day, and normal glomerular filtration rate, no treatment needed other than follow-up to check renal function. If
Exactly.
persistent proteinuria above 500 to 1000 milligram per day, a normal or only slightly reduced GFR, initial treatment is with ACE inhibitors. If there is
Perfect.
active disease, falling GFR, or failure to respond to ACE inhibitor, immunosuppression with corticosteroids. This is the
Perfect.
management plan.
Perfect. Thank you. You can share it, Dr. Salma, right? You are Dr. Salma or Dr. Maha? Dr. Maha. Yeah, please.
Dr. Mahmoud. Okay.
Yeah, if you can, just screenshot and send it to the group for refreshment. Thank you, Dr. Maha, and thank you, Dr. Suzanne, Dr. Hajwa. Really, both cases was or were perfect and good cases. By the way, hematuria might be presentation of infective endocarditis. So you might have the case of hematuria and the presentation would be infective endocarditis. Okay.
Okay,
The
thank you,
Yesterday, I
presenting.
attended one session. Yeah. Yesterday, one case came with the same
Yes,
presentation,
yes,
hematuria and
hematuria
clostros.
and the
Yeah.
background of infective endocarditis. Yes,
Yes. Yes.
it's
Metallic
common
valve.
case, by the way. It's
Yeah.
a common case.
And warfarin. Yes.
Okay, so who wants to talk? Dr. Dalia? Someone was talking. Any question or any comment? Dr. Aisha, any comment?
No, nice cases. Thank you.
Okay. Anyone want to add comment, please? Dr. Dalia wrote comment. Okay, I will read it now, Dr. Dalia. Where is it exactly, Dr. Yeah. General symptoms, family history. Ask father at which age any other family member has cancer. Dr. Inas, share rubber cause bladder cancer. Exactly. That's why we can put it as a differential, but again, it's the bladder cancer. The hematuria is not blood through or all the urinary stream. The bladder cancer or the bladder source of blood will be terminal, right? This is what
Yeah.
I remember also, yes. The urethra, it will be initial, the cancer will be terminal, and the glomerulonephritis will be all through. And this is a very perfect question to ask, to know what's your source of blood. As Dr. Susan did, to know from where this blood coming, either kidney or urethra or the bladder itself. Dr. Dalia, please, Dr. Basim, the occupational department can do nothing in this case. If you emphasize this, please. Yes, I agree. Occupational need to be mentioned only if you want to reallocate a person in his job. Apart from that, don't call them. It made no sense, or it made no sense to the examiner to call occupational therapist or occupational worker for this patient. Okay,
But Dr.
occupational.
Also,
Bassem,
Dr. Bassem,
given,
the free jobs have no
yes,
occupational
Exactly.
department in.
So no need to mention this
Uh,
team now. You mention occupational worker if you have staff nurse or doctor has some problem in his job. This is the main issue of occupational worker.
do we need to
Patient
admit
for
this patient?
admission or
Sorry,
admitted.
or admitted patient.
Patient is already admitted, no need to sing for occupational like that.
Yeah, exactly.
Already admitted.
And do we need to admit this
Quick label.
patient?
Who's asking this question for admission?
I'm the one, Dr. Maha.
Okay, Dr. Maha, what do you think? I'm asking because you have to answer this question.
Yes, because this patient came with high blood pressure, okay, but it is not that
Yes.
much high, and it is 160/80, okay. I think we can control it as outpatient, and we can do all this investigation as outpatient. We're seeing so many patients of IgA nephropathy,
So,
and we are not admitting them
okay,
unless they
perfect.
have just like pulmonary edema or they have like
Okay,
decompensation, okay.
perfect. Let's make it diplomatic answer, right? In diplomatic answer. I will do some blood test to check if you need admission or no, right? What do you think
Okay.
the need of admission in this patient if you find what in his blood work?
Increasing renal function, like
Yeah,
deranged renal function, yes.
perfect. So renal function affection or anemia, right?
Yes, severe anemia. Yes, severe
He has
anemia.
because anemia
Yes,
or
if not severe
severe
anemia, no need
proteinuria.
to. Yes,
Yeah.
yes. If patient need immunosuppression, IV immunosuppression,
Yes,
as you
exactly.
mentioned here. Yes, but at this level, do I need to advise the patient with admission because I don't have this data? Okay, all this data I don't have it right now. I don't have the renal function. I
That's
don't
why,
have
yes.
the
So we will
yes,
do some blood workup to decide for
yes,
this.
yes, yes,
But
yes.
for the
Okay,
infective
thank you so much.
endocarditis patient, it's clear cut
No,
of
yeah, that
indication to be
no
admitted.
need.
Yeah,
Yes. We have to admit all patients here.
perfect. Yes, thank you, Dr. Ma.
Thank you so
Another
much.
comment from Dr. Dalia. Oh, thank you. If positive family history of renal cell cancer, von Hippel-Lindau syndrome is one of the differential. And we will search about vision again and balance problem just to know if he has any association. It might lead us to von Hippel-Lindau. Although it's rare, but it comes in the PACES exam. Put it in your mind even once and keep it in your differential as a rare presentation, but it might be presented. But if you have a clear cause, like in this scenario, glomerulonephritis, IgA, so it's not the case. But again, if you don't find a cause, put this and as a differential, von Hippel-Lindau. Thank you, Dr. Dalia, for reminding us. Okay, Dr. Hatim, not necessarily all Dr. Salma mentioned may cause both micro and macro. Actually, I am not sure about this point, macro and micro. If someone nephrologist, he can answer clearly about these points. I cannot see this file, Dr. Hatem. If you can share it to the WhatsApp. Regular follow-up is important. Yes, thank you, Dr. Maha. Blood pressure control. Dr. Dali, I wrote sick leave enough. Yes, I believe sick leave is enough for the for any occupational issue if the patient will be admitted. So you can tell him, I will offer you sick leave safely. You are a physician. You can provide
But
him
also
with a
in
sick leave.
3 jobs, it's not practical. Just a social worker you will refer.
Yeah, it
Because
depends on
here
his
she
job.
said
Yes.
that I am working, I think, in bookshop like that. So she complained to her that I can't go. So she will support only by social.
Okay. He's working as employee or he's working as owner of the shop. You don't know. Still, he might need sick leave. Is he's working or if
But
he's hired.
he mentioned this is his own job,
Yes,
his
she
own.
said
It's okay. If
3
his
job.
own job,
Yes.
it's okay. He will not ask you for anything to support him unless he's financially unsupported. But anyway, offer
Actually,
sick
you
leave.
have to offer sick leave first. When you decide to issue sick leave, you have to offer the patient first. If you need sick leave, I will
Yes,
like that.
exactly. Yes, exactly. Yeah. Or if he asks you what I will do with my job. Okay, if he asks you particularly about the job, you can say, okay, we can provide you sick leave if you need. Dr. Dalia, all kidney cause of hematuria, although changing in urine color is not noticeable. Okay. You mean for the differential or for the microscopic and macroscopic? You mean the microscopic even might be also noticeable? You can notice? Yes, differential. Okay. But we have to put the most common, then the less common. As this patient is having family history of renal cell carcinoma, so it's very strong differential. I should put it, especially if the patient have any history of constitution symptoms. Okay, Dr. Dalia again. Von Hibbelin ask about lumps and bumps in the family. The patient needs reassurance. I will do my best to help you. Yes. Even you can say it once. No need to mention it frequently. Once is enough. To be on safe side, Dr. Rashid, better to admit on ground of high blood pressure. Sometimes you can say admit in the emergency until finishing because you might give him some medication to reduce the blood pressure and you can refer him to the nephrologist or nephrology clinic. So don't give clear answer. No
Yes,
admission. Yeah, make it
until
also
nephrology
exactly
reviews, huh?
need until he will be reviewed by the kidney doctor. If
At
he need
least.
admission, it's okay. Or at least the blood workup will be released if there is blood hematuria or if there is macroscopic hematuria. Sorry, not macroscopic proteinuria. I mean, or anemia. So make it as a delay answer for the concern of admission. To be safe, okay. Do we need renal biopsy? No, I don't think IgA nephropathy. No need for renal biopsy. Good question, Dr. Sarah. Any comment or question? Clear for all? Satisfied?
Thank you, Doctor.
Okay, most welcome, Dr. Suzanne and Dr. Hajwa. Well done as a first practice. Really, you did with confidence way, but I want you to be more sympathetic and empathetic as a professional one. But the approach you followed is perfect. And also the examination steps. Dr. Hajwa need only to fill some gaps in the history taking, in the system review, in the social history, in the occupational. Apart from this, both of you did great. Thank you for practicing today. Yeah,
Thank you.
very confident. Okay. Thank you everyone for sharing comment, for attendance, for participation. Thank you everyone for the comments
Thank
as
you,
well.
Doctor, for this
Yes.
opportunity. Thank you.
Thank you. You deserve. Thank you. Okay, see you tomorrow inshallah with the communication day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.